Thanks. Nice to see everybody. Nice to meet everybody. Thanks for the kind words, Erica. I'm going to cherish them, remind you at Christmas of all the nice things that you just said. Um, very happy to be here talking with you folks. Frank asked me to talk a little bit about my WASH project in Malawi, because I think that you guys have some familiarity with such types of projects and have an interest in it. I tend to do these presentations fairly informally, so if anybody has any questions as we go along, just let me know. But to start off here, I should probably share my screen. All right, so hopefully you can see that. All right, there we go. Okay, so if anybody thinks that they can't see it or something like that, let me know. But so one of the things that I was asked about was this project that we've been working on for a while now. And what it is focused on is WASH and healthcare facilities. And the idea is to generate health and empowerment. And we did this through basically innovating an approach to this. So it's a little bit, the presentation is going to talk a little bit about that. But the first thing I probably should talk a little bit about is myself. Erica sort of said most of this stuff, but I am an associate professor in the School of Business at Royal Roads, beautiful campus on the west shore of Victoria. And it's located on the unceded lands of the Coast Salish people. And so we're very, very privileged to be able to live, work, and play on those lands. I was the past president of West Shore Rotary Club in Victoria. It is a fairly decent sized club, not the biggest, but about 30, 35 members. And I was chuckling a little bit as we were going through the Zoom process here, because I can relate to the Zoom issues that have plagued the Rotary clubs across the world over the last couple of years. We've started to meet more in person now, so that's been quite nice. As Erica mentioned, I've got projects in Africa and South America, one of which is several $1 million. The other one, this one, was several $100,000 in value. And I focus on sustainable social economic development, food security, food systems, women empowerment, WASH, global health, number of areas like that. So let's get into this WASH and healthcare business. So many of you are probably familiar with what WASH is, water, sanitation, and hygiene. And that's very, very important to understand. But it's not necessarily the only element to it. Most WASH that's talked about is talking about community WASH. There's an increasing interest in WASH in educational settings, in schools, and so on. But one of the areas that is actually not well understood, shockingly, frankly, when I found this out, was this idea of WASH in healthcare facilities. And so obviously it's water, sanitation, and hygiene, but what it means for healthcare facilities is things like, is the water running? Do you have the right quantities? Is it safe to drink? On the sanitation front, toilets are available and functional. Do they have privacy? Do they maintain dignity of the people that are using them? And a big problem at healthcare facilities is dealing with bio and medical waste. So there's a lot of byproduct from surgery, from delivering babies and so on, that needs to be disposed of properly to maintain the health and safety of the community. And then we've got hygiene as well. So you can imagine how critical hygiene is in a healthcare facility. Are people washing their hands before doing surgery? Are they washing their hands and disinfecting when dealing with patients? Menstrual hygiene management is a major issue, especially in areas where that can be a little bit more of a taboo subject. So these are things that are very, very critical. And so what's the situation? So globally, it's a real big problem. The lack of WASH in healthcare facilities is a very significant problem. There's uh, about well, half of healthcare facilities don't really wash hands properly. 1 in 5 don't have access to water. 1 in 10 don't have sanitation services, so toilets and so on. And this is globally. So if you actually separate out, the poorest what we call the least developed countries, LDCs, the poorest 40 countries in the world, these numbers are, in the high, 70%, 80% don't have proper facilities, proper water running, and so on and so forth. And WASH is actually really, really key. Having good source of water, proper practices, and so on is key to limiting hospital-acquired infections and community disease outbreaks. So, we became very acutely aware of the importance of washing hands and hygiene practices when COVID hit. But it's not just COVID. Ebola is actually transmitted by germs that can be addressed by proper sanitation and hygiene. Cholera, right now, Malawi is going through the worst cholera outbreak in its history. It's claimed the lives of about 1,200 people so far, very high mortality rate, and they're really struggling to get it under control. All of those things and many others can be addressed with effective WASH. And you can imagine how critical it is to have this in healthcare facilities, because when you are sick with one of these things, that's usually where you go. And so making sure that that's not a point of transmission is really, really important. It's also extremely important for the health and dignity of women, especially when delivering babies. Women tend to disproportionately not only work in healthcare facilities as staff, but they use them more frequently and more acutely. So men will show up at healthcare facilities with, a broken arm or something or maybe they have malaria. And so they get some pills or they get some treatment, but they tend not to be exposed to infection the same way that women giving birth would be. So it's very, very critical for the health and safety of women. So a little bit about Malawi. It's often referred to as the warm heart of Africa. It's actually a wonderful place. It's landlocked. You can see down here, I'm not sure if you can see my cursor on the screen, but you can see down here that it's in the southeast of the continent. And here's a zoomed in on the country, very small country. It borders Lake Malawi, which is one of the largest lakes in Africa, part of the Rift Valley system. Even despite the size of this country, there's almost 20 million people in the country. Very disproportionately young. It's about a 2% birth rate, which is quite high, and very poor country. It's one of the poorest in the world. About 70% of people live in extreme poverty. So that's less than about, I think that the measure is about $2.14 or something like that per day. On average. So that's very, very difficult to get by on such a low amount of money. And life expectancy is about 64 years of age. So that's substantially shorter than, a country like Canada. But very beautiful, very welcoming, very friendly. One of actually the nicest places that I've worked in, and I really actually enjoy it. These are not stock photos from the internet. These are my own photos or people that I was traveling with. They have the lake on Malawi. It's actually stunning how beautiful it is. It's a freshwater lake and it's very warm and it's got these beautiful beaches that go for miles along it. And it's actually really wonderful. If it was anywhere else in the world, it would probably be dominated by huge hotels or something. But because it's Malawi, it's still pretty pristine and underdeveloped. There's a fair amount of wildlife, although going to Zambia or Tanzania is a little bit maybe more popular for doing that kind of thing. But a really beautiful place. So WASH and healthcare facilities in Malawi specifically is even more problematic than sort of the global average. So these are maybe a bit of a few shocking pictures here, but there's huge gaps in this. We went in 2019 or my colleagues went in 2019 to do a bit of an assessment of the conditions and found it to be very, very, very problematic. You can see things like, in the top left here, there's this leaky pipe. There's another one outside on the bottom left. That's very common to have stuff like this where there's just not even something as simple as a little gasket or a little bit of piping tape or simple infrastructure like that is expensive. People aren't trained to fix it. There's an entrenched sort of behavioral system where things kind of get ignored for a very, very long time because there's simply not the money and or the will or expertise to fix these kinds of things. You can see the toilet here in the middle. This is actually in a maternity ward in one of the largest hospitals in the region where we were working, which is in northern Malawi. Over on the right here, you can see, to really put this into perspective, this is a bathroom with a sink, and because it's one of the only places with running water in the facility, this is where they're actually cleaning the surgical instruments. So those are all surgical instruments right there that are going to be used right away to do probably simple surgeries or help deliver a child or something like that. I mean, you can see the state of the floor, the walls, the toilet, and so on. And this is just right next to it. To put things into perspective as well, my wife is actually a nurse in an operating room. And if you talk to her about the procedures that go into sterilizing this kind of equipment and so on, it's extremely intensive and high. And I mean, there's a huge concern for making sure that they're sterile and so on. And then lastly, you can see down here, this is a zoomed in picture. This is a blood bag and a needle that's just lying outside the hospital, just on the just in the grass. Animals can get into it, kids can step on it. There's a very high rate of HIV in Malawi. So really problematic situation. If you zoom out of this picture, there's tons of this stuff. So disposing of this kind of stuff is often not done or done inappropriately. So lots of issues to work on in the country. And, this affects people. The conditions are very, very difficult. The large picture on the right here, these are all women that are in labor waiting to give birth, and they are crammed into a small room. They're just given a small mat to lie on, maybe a pillow, maybe not. That's the conditions in the maternity ward at one of the larger hospitals. This woman here on the top left, she's got a small infant that she's seeking care for, and she's got to stay at the hospital, but she has to lie on the floor, small mat. She has to bring all her own blankets and things like that. Very difficult conditions. And all these children on the bottom left here, all those children are HIV positive. And so they're there at the clinic waiting to get medicine to address or to help out with their condition. It's crammed. It's difficult to access those products. So very, very difficult conditions. So to address this, we came up with this innovation we called Streams. I'll admit we worked kind of hard on trying to come up with a clever acronym, but it actually worked out okay. So it's a fairly comprehensive program. The idea is that you have systems that you fix, so water infrastructure, sanitation infrastructure, waste disposal, and doing repair and maintenance. And this is a really key thing, is that sometimes they do get donor funding to build a new set of bathrooms or to upgrade a surgical ward or something like that. But the problem is that they atrophy and disintegrate very, very quickly because they're not maintained properly. And so something that could last, several decades actually only ends up lasting, or at least being as effective as it could be for a couple years, mainly because things just aren't fixed or maintained properly. Training, so providing training on hand washing, things like that. One of the big things too is emphasizing wash. training on job descriptions and making sure people are doing their tasks appropriately. Big focus on empowerment, people with disabilities, women, and the empowerment of staff. There's a huge power imbalances between leaders and people that are delivering care, especially cleaners. Cleaners are sometimes viewed as the most lowly people in the facility, yet possibly have one of the most important jobs. And so they get kept being told to go do something that's not part of their job. So cleaning gets neglected, and that's a big problem. And then we do a fair amount of monitoring support. So this is a way of making data-driven decisions, showing empirically that what can be done, and so that leadership can actually make decisions effectively, and so that we can make a strong case for why they should make the decisions they should make. And the way that we do this is through something called a circuit rider approach. And what this is that you have basically a circuit rider is like a roving expert. So this is a person that's highly trained that will go around. Each one is given about 4 or 5 facilities, and they're given a motorcycle, and they go around to different facilities and visit them about once a month to really emphasize this stuff, to provide ongoing support, ongoing training, ongoing maintenance and repairs for the people at each healthcare facility, because these are often jobs that don't necessarily, there's people there that should be doing them. It's just that they don't necessarily have the capacity, or somebody's not, reminding them to do it effectively all the time. And because of the comprehensiveness of this, there are actually 2 circuit riders that do this in any given area. One is a technical circuit rider, and they do a lot of the maintenance and stuff. They have some expertise on using solar pumps and plumbing and those types of things. And then the quality of care folk are the ones that are more oriented towards how to treat with patients, how to have proper hand hygiene, separate waste effectively, so on and so forth. One of the things that we found very, very important in all of this, because of the makeup of the staff and patients at these facilities, the users of the facilities, really embedding the importance of women's empowerment and gender equity was really critical. So a lot of our training is focused on women's roles, making sure that women's work is valued, trying to sort of have gender-based policies, and not only that, but understanding the needs of women for infrastructure, so menstrual hygiene, private toilets. I mean, because some of this infrastructure is so degraded that there's no locks. Sometimes there's not even doors on the toilets. And so for a woman who's pregnant or visiting the facility for some other reason, having that dignity, that ability to find privacy, feel safe at a place, that translates into more community buy-in in the use of healthcare facilities, which then by extension reduces infant and maternal mortality and things like that. So it's really critical piece. This might not be so interesting to you, but as an academic, I'm required to talk about how we collected all our data. Suffice it to say, it was fairly comprehensive. We did what was called a comparison group, where the idea is that one of the problems in development research is quite often that you can show up, if you pick your people right, everybody will tell you that what you're doing is fantastic, and then you go out and say that what you do is fantastic because, well, the guy that we've hired for the last 2 years told us it's fantastic. Well, of course he's going to do that, right? So there's a big push recently, and in fact, one of the more recent Nobel Prize winners in economics won their Nobel Prize for arguing that you should have randomized control trials similar to the way that they investigate new medicines, as a means to objectively evaluate various development programs. So we've been taking that approach, did hundreds of surveys with different users of the healthcare facilities. And some of the results that we had were quite encouraging. Better practices, WASH health practices, patients reporting caregivers using hand hygiene went up, managers reporting gender sensitive training, increased effectiveness, better drinking water, less water supply disruptions. A lot of the healthcare facilities, there's 18 that we're working with. A lot of them didn't have running water. Now they do. Simply by fixing small things. I mean, you'd be shocked at how simple some of the fixes are. That, you know, some valve is closed and nobody knew that this valve existed. And so all you do is you have to turn on the valve and suddenly there's water in the facility and things like that. So, you know, fixing a small washer, you know, repairing a pump makes a big difference. So this is some of the real key things. There's still things that we're working on. The project is ongoing. You know, we have positive perception, but not a lot of change. Recommendation has gone up only a little bit to the community. There's, you know, a little bit more cleaning that could be more effective. It's hard because when you're interviewing people, sometimes people haven't used a healthcare facility for a while, and then they come and perception of change is hard to extrapolate. But nonetheless, it's pretty interesting. Some behaviors still need to be worked on. So hand washing, and then a big one is still the job descriptions and making sure that people are doing the right jobs for staff, because there's a lot of bureaucracy and government intervention and that kind of thing. But here's just some pictures of some of the successes as well. We're doing water quality monitoring, so that's never been done. That's making sure that there is no cholera or fecal matter or E. coli or anything like that in the water. Fixing pipes and doing maintenance so that the water is running. Cleaning. So cleaning has been built up. If you go to a lot of these facilities, there's lots of garbage and things that's just around the facility. And I mean, some of it's fairly innocuous, but some of it, as I mentioned earlier, can be quite dangerous. And so disposing of it properly, cleaning up the facility grounds so that people aren't stepping on things as they come into the facility and so on is really important. One of the other things you'll notice here is the use of PPE. Maybe not exactly perfectly as they should, but this is a bit of a much bigger improvement than what it used to be. The other thing you'll notice is that there's a fair amount of gender equity. The outside folks are mostly men, actually, which is nice to see. But even the interior cleaning, which is often relegated to women, you can see that there's men and women doing it now. And we even had responses from men saying, "Oh, we didn't know that wasn't fair, and you know, that's a good point. We should do it." So a lot of training, how to do proper hand washing, which of course is really critical at healthcare facilities. Even just small things, repairing bathrooms, marking them, men's and women's, so that there's not, you know, people accidentally barging in on each other, and having that, again, that dignity and safety, doing various forms of training. So some overall impacts have just been system functionality, better wash practices, generally better training. We have wash fit teams, so there's a sense of priority and sense of urgency amongst the staff themselves to do this as well. And again, those circuit riders come around every month and ask them about how it's going, what kind of things that they've done this month to improve wash and so on. So some really nice impacts there. And how's Rotary involved? Well, what's actually quite interesting is the entire idea of wash in healthcare facilities is very much spearheaded by a lot of Rotarians. Many of you might be familiar with the Rotary Action Group, WashRag, which is quite a prominent organization. Over on the right here, you can see there's actually a talk coming up right away that you can join in on, which should be very, very interesting, about wash in healthcare facilities. Again, this is a topic that very oddly has been under-researched, under-focused on, despite its, I would argue, you know, it's probably most important in healthcare facilities, but oddly has not really received a lot of attention until recently. Lindsay here is actually a friend of mine. We've collaborated a bit in the past. So Rotary is a real leader in this. The other organization that I partner with is Transform International, which is an NGO based in the United States, but we have a Transform International Canada as well. And they are actually mostly Rotarians. They have organized themselves to be basically an organization that facilitates good development in the global south. And various Rotarians join, and they each often have their own projects, but it's a way of sharing knowledge. We meet about once a month to share different projects, problem solve, share resources, fundraise, things like that. And it's actually been very, very successful in doing a lot of projects. The other nice thing about it is that our own Rotary Club, my own Rotary Club, got involved with them as well, largely because of my push on this. But it's, you're working with people that are embedded in the communities, that have connections with the government, that have connections with the water boards, that are really sort of already there. So you get, it smooths out a lot of the friction that goes on in a lot of these projects. And here on the left, you can see this water tower that was built, and we keep building small pieces of infrastructure, but a water tower is a little bit more expensive. So you have to raise a little bit of money to get something like that at a healthcare facility. And you can see, it's hard to see in the picture, but right here, there's the Rotary Club of Niagara on the Lake sponsored this in partnership with Transform, and of course the health district as well. So building those relationships is really critical. And that's about it. The partners in this are various organizations and funding organizations that have supported this for several years. The project continues, and we're actually looking right now at a fairly large application, probably around 7 figures, 8 figures actually, for scaling up this program in Malawi with funding from the government of Canada. And here's the last thing, just to show how appreciated work of Rotary is in the area. Videos don't always work so well on Zoom, but I'll give it a try because it is kind of nice here. So that's about all. Thank you very, very much. And if anybody wants to ask any questions, happy to do that. But let me stop sharing here so that